Hello everyone, Dr. Virginia Ellis over here. So right now I'm going to talk about emergency dental services, okay? What qualifies as a dental emergency? So dental emergency symptoms, emergency dentist near me, and when to seek emergency dental care will be discussed right now. So a dental emergency is obviously if you have an accident, you break a tooth off, you have a car accident, you have really bad dental pain and you can't sleep at night and it's throbbing and it doesn't stop. If your face swells up, that's a dental emergency. If you just have like a little sensitivity or you have a filling that chipped off, that's not a dental emergency, okay? That you can call when the office opens up. But if you do have a true dental emergency like I just described, do call the after hours number. I have an after hours number where you guys can call in and we'll have a live person calling. One of our staff will call, they'll call me. I have my cell number if you really need to get a hold of me where you can call me, okay? So that is a true dental emergency. Swelling up to here, pain that you can't handle, just an infection, call me. Car accident, bike accident, any kind of accident where you're knocking a tooth out, call me, okay? What should I do if I lose a tooth? Very good question. So first of all, try not to freak out. Stay in control, okay? So if you lost a tooth emergency, you knocked out a tooth, knocked out tooth care, saving a last tooth, the one thing you want to do, I'm going to have this kind of a gross thing in here, okay? So let's say you knocked your tooth out. What you want to do is you never hold it by the root. So if it drops on the floor, something like this, don't hold it by the root. Always hold it by the crown, okay? Oh, see, I dropped it. I'm going to pick it up. I'm back, but what did I do? I hold it by the crown, not the root, because the root has a skin over it right here, like right here, that pink area. It's called a periodontal ligament. And if you injure this, when you put the tooth into your mouth, you will ankylose or fuse the tooth to the jaw. You don't want to do that. So if you're able to, and it's only one tooth that you've knocked out, what you really want to do right away is just put it back in like this, okay? If you're not sure, what you could do is put it in milk, okay? If you play sports like basketball and you're concerned about, if you're a coach, what you can do is buy something that's called Save a Tooth. If you're freaking out, you don't know what to do, open this up, put this tooth in there, and the best thing to do is to run to a root canal specialist because they will assess the tooth. No matter what, you usually have to take care of it and diagnose or do an exam to see if that tooth will need a root canal. So that's what you want to do. Put it in one of these. You don't have this is kind of hard to get. You can get it on Amazon, get it through a dental specialty store, okay? You can also put it in milk, okay? So if you put it in cold milk and rush and have the tooth replaced, if you can get to it within like 20 minutes to have the doctor take care of it and put it back in there, that is the best thing to do. So what do? Don't lose your composure. Don't lose your control. Stay in control. Stay calm. Pick up the tooth. Do not let it air dry, okay? You could just do this, put it in your mouth, and if obviously the tooth is going to be loose, you could bite on something like a towel, a t-shirt, just very gently to keep it in place so it doesn't come out. Call the doctor, have someone call the doctor and go see the doctor. They will go ahead and take measures and do stuff to take care of the tooth, okay? So, all right, that's the most important part. Let's see, can you treat a broken tooth in one visit? So broken tooth treatment, one visit, dental emergency dental repair options. A lot of times you can. It just really depends on the situation, okay? If you knock out a tooth, obviously we'll bond it. We'll put an orthodontic, a braces wire. We'll bond it. We'll take x-rays. Many times we'll send you, again, to the endodontist, okay? So sometimes you can break off a tooth and we can fix it in one visit, but it really does depend. Sometimes I had a patient who fell on the driveway while she was out of town in another state, and she broke her jaw as soon as she landed from the airport. This is the day before coming here, poor thing. She wound up going to the maxillofacial surgeon. The oral surgeon had to have wires put in her jaw to hold it in place, and then later on fix the teeth. So it just depends on the severity of your accident, okay? just give us a call and we'll treat you right away. If things can be fixed right away, we will fix them in one visit. It depends on your particular needs and the situation and the complication that develops. All right, so how do you handle dental emergencies after hours? So after hours emergencies, dentist, the 24-hour dental care, what to do in a dental emergency at night. Obviously, if you have a car accident, go to the ER. A lot of times they have an oral surgeon on board or on call so that they can come over and take care of the jaw, okay? And you can also call your dentist, and we can get in touch with the other specialist. That's the best thing to do. Go to the emergency room if it's a big accident. If it's not like a car accident, you're not like, seriously injured in your head, your neck, give us a call and we can do the legwork for you, okay? We can see you, we can call other specialists to go ahead and help you out. That's the best thing to do. So the contact options, call me, call your general dentist, we call the specialist, or go to the ER. That's the important thing. Okay, what can I do to manage severe dental pain at home until my appointment? Okay, so to relieve severe tooth pain, emergency toothache relief, and home remedies for tooth pain are as follows. If you are swollen, okay, you're going to give me a call. You're going to give the dentist a call. That would be a time to have antibiotics. If you're not swollen and you have pus that's draining, you do not need antibiotics, okay? Every case is different, okay? Asterisk in there, unless you're immunocompromised. But usually you don't. Usually you don't need antibiotics if you have an infection that's draining, all right? If it's not draining, you usually do need antibiotics. If you're just having pain, what you can do, if you don't have any what's called contraindications to Tylenol or Advil, you could take a combination. If there's nothing in your health history that says that you cannot have Advil or Tylenol, the best thing to do is to take like 600 to 800 milligrams, okay? Not 600 to 800 tablets, milligrams. Usually 3 or 4 Advils with 1 extra strength Tylenol. That has shown in research to be just as effective as a Vicodin. Every, I would say 4 to 6 hours as needed for the relief of pain, okay? So Advil takes one pain pathway, Tylenol takes another pain pathway, and if you take those, they can both work very well to relieve pain, okay? Obviously, saltwater rinses, yes, but for pain, that is the best thing. You could give us a call, and we can walk you through it. But ice, sometimes if you want to put ice to help kind of numb it a little bit, you could do that, okay? Heat, I wouldn't advise heat because that can spread liquid, and if you have an infection like an abscess, that'll make it hurt like the dickens. You don't want to do that, okay? All right, if you found this information helpful, please press the like button and subscribe to the channel for more useful and helpful information. I will go ahead and see you at the next video. Bye-bye.